Everything ready?
Yes, I'm ready.
Okay. Good morning. Welcome to the Todd County Board of Commissioners meeting on Monday, November 2nd. We moved it up due to election tomorrow. The public is not allowed to attend in person, and we are live streaming the board meeting, and hopefully everybody can hear us and view us. We'll try to speak into our microphones this morning. Attending remotely will be the media, Commissioner Becker, Jeremy Klausman from Solid Waste, and attending in person will be Sheriff Ock, Mike Wizanowski, Emergency Management Director, Jackie Ock, Health and Human Services Director, Catherine McIndence, Health and Human Services, Chris McCon, Solid Waste, Denise Gaida, Auditor Treasurer, Chris Pelzer, Coordinator, and Rick Utek, our Economic Developer. I will call the meeting to order, and as I said, all commissioners are present except for Commissioner Becker, who is on the phone, attending by phone. So let's stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, because of one commissioner being absent this morning and on the phone, we will be taking votes by roll call on all actions that we take in front of the board this morning. So be a little difficult, but we'll try and get through it. Is there any amendments or corrections to the agenda?
I have none, Mr.
None?
Chair.
So do I have a motion to approve the agenda as is?
So moved.
Motion by Commissioner Knizel. Is there a second?
Second.
Second by Commissioner Newman. Discussion? If not, roll call, please.
Commissioner Knizel,
Yes.
Commissioner Newman,
Yes.
Commissioner Erickson,
Yes.
Commissioner Becker,
yes,
Commissioner Kircher.
Yes. Okay, then we'll go to consent items. Denise.
We have meeting minute approval October 20th, 2020, and hire part-time road deputy John Fick.
Okay, you've heard the potential consent items. Is there a motion to approve?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Newman. Any more discussion? If not, roll call, please.
Commissioner Erickson,
Yes.
Commissioner Newman,
Yes.
Commissioner Knizel,
Yes.
Commissioner Becker,
yes,
Commissioner Kircher.
Yes.
All right, my next item then, under the Auditor Treasurers, is the Auditor Warrants, October 2020. Background was sent for review. Recommendation is the Todd County Board of Commissioners approve the following by motion: to approve the October 2020 Auditor Warrants with an ACH and a regular manual payment totaling in the amount of $6,922,974.08.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Knizel. Discussion? Roll call, please.
Commissioner Newman,
Yes.
Commissioner Knizel,
Yes.
Commissioner Erickson,
Yes.
Commissioner Becker,
yes,
Commissioner Kircher.
Yes.
My next item is Commissioner Warrants. Background was sent for your review. Recommendation is to approve the Commissioner Warrants with an ACH and a regular manual payment totaling in the amount of $75,968.61.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner
Trying to get
Knizel.
Barbara.
Barb, we're trying to get you in there, but you're not.
that's fine,
Okay.
absolutely fine.
All right. Any more discussion? If not, all those in favor say aye.
Whoops.
Nope,
No.
roll call.
Here we go. Keep me straight here.
Commissioner Erickson,
Yes.
Commissioner Kneisel,
Yes.
Commissioner Newman,
Yes.
Commissioner Becker,
Yes,
Commissioner Kircher.
Yes.
All right.
Sorry about that.
Just had to mess me up. Health and Human Service Commissioner warrants is my next item. Background is sent for review. Recommendation is to approve the Health and Human Service Commissioner warrants with an ACH and a regular manual payment totaling the amount of $47,914.49.
Okay, for the board action, is there a motion?
So moved.
Motion by Commissioner Newman, is there a second?
Second.
Second by Commissioner Becker. Discussion? Roll call, please.
Commissioner Newman,
Yes.
Commissioner Becker,
Yes.
Commissioner Erickson,
Yes.
Commissioner Kneisel,
Yes.
Commissioner Kircher.
Yes.
The next item is the Health and Human Service SSIS warrants. Background is sent for review. Recommendation to approve the Health and Human Service SSIS warrants with an ACH and a regular manual payment totaling in $54,216.28.
Okay, for the board action, is there a motion?
So moved.
Motion by Commissioner Kneisel, is there a second?
Second.
Second by Commissioner Erickson. Discussion? Not, roll call vote.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker?
Yes.
Commissioner Kircher.
Yes.
The last item I have today is the adopt the 2021 county fee schedule. Background, the Todd County has built a county fee schedule to be implemented for 2021, and a public hearing was held on October 20th, 2020, to gather any public input on the proposed fees. Our options are to adopt the fee schedule, do not adopt, or to adopt the fee schedule with desired alterations. The recommendation is to adopt the 2020 county fee schedule to be effective January 1, 2021, per the attached document.
Okay, heard the request, is there a motion?
So moved.
Motion by Commissioner Erickson, is there a second?
Second.
Second by Commissioner Kneisel. Discussion?
Yes, Mr. Chair. Did anybody get any response on that?
I did nothing.
I didn't.
Nothing either. Okay.
We did not at the office either.
Okay, just thought I'd ask that question.
All right, roll call, please.
Commissioner Erickson?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker?
Yes.
Commissioner Kircher?
Yes.
Thank you.
Barb, can you hear us? Good?
Yes, I can.
Okay, and, okay, media, can you hear us good? Guess we're not on, so.
I hear you, Dave.
Okay, thank you. All right, administration then, Chris?
Okay, Mr. Chair, I have a couple of board actions this morning regarding the CARES Act. And the first board action that I have is to award the second round grant for small business relief and nonprofits. The background for this is the second round small business and nonprofit relief grant program applications have been reviewed for eligibility by the Grants Committee and are recommended to be awarded. The options are to award the grants approved for the Todd County second round small business and nonprofit relief grant program or to not award. And the recommendation is to award. And Mr. Chair, I'd like to just share with the board members the total amount of award that we are proposing for today is $676,693. So that is a total of 84 grant applications that are ready to be approved. The smallest grant amount in this bunch is $900, and they go all the way up to $10,000, so kind of the full gamut of range. So good participation, good response.
Okay. And, was there any denied, Rick?
Just one that they had 30% over, 30% higher profits this year.
Oh, okay,
And part of those were service, automotive service, where all of them did well
okay.
this year.
Okay.
I talked to a couple others, and they all didn't apply because their profits were way up.
Okay. Okay, so we need to approve this then?
Yep, you do, Mr. Chair, and Commissioner Becker will abstain from this.
Okay. Is there a motion to approve this awarding of these funds, right? Okay,
So moved.
motion by Commissioner Kneisel, is there a second?
Second.
Second by Commissioner Erickson. Any more discussion? If not, roll call.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Newman?
Yes.
Commissioner Kircher?
Yes.
And I will note Commissioner Becker abstain.
Correct.
Abstaining, yes.
Okay.
Okay,
Thank you. Next board action that I have is to approve a third round small business grant relief program through the CARES Act CRF funding. And the background for this, at the last board meeting, we talked about there were some businesses that had applied for the Minnesota Deed State Lottery program and were awarded a $10,000 grant. With our first round of applications, those applicants were excluded from being eligible, so we had approximately 5 businesses that were not eligible to receive the funding. It was the board's wishes for us to bring this back and allow those applicants to apply for the $5,000 grant. So the background is CARES Act CRF funds remain available for small business relief due to COVID-19 pandemic. Todd County's first round small business grant relief excluded businesses who received funds through the Minnesota Deed Lottery program. Due to funds remaining in the small business relief program, an application has been created to allow for businesses who receive that M&D lottery funds to apply for up to $5,000 of grant funds if application criteria is met. So the options are to approve the third round small business grant relief grant or to not approve, and the recommendation is to approve.
And if I may, how much money is left to do that, or do we?
That would be $25,000 if all of them reapplied. Yep.
And then after that, would there be money left over?
Yes, and we have extended our second round grant for until November 13th.
Okay. All right, so then when we get near the end and will there be money left over, do you think?
There will be funds left over that we could continue to issue grants, that we could continue past the 13th. I mean, we don't know how many we're expecting. We're hoping we're gonna get at least 20 more applications.
Okay. All right. So is there a motion to move forward with the nonprofit? Is that what it is?
This would be the third round
Third round?
grant program.
Okay. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Kneisel. Discussion.
Is this end 13th too, November 13th, or is there an end to this applying?
They're anticipating they're just gonna apply quickly and it could be done by the 13th. We didn't put a deadline, but
Well, I didn't know if you.
Fairly certain they'll apply right away.
Yep.
Once they find out.
Okay. Any more discussion? If not, roll call. Whoop, I'm sorry.
Commissioner Newman?
Whoop, Gary, did you have a question?
I'm sorry.
Well, I was gonna say, do we have to have this done handed out by the December 1st, or what?
everything has to be completed by December 1st. Yep.
Okay.
Commissioner Newman?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Becker?
yes,
Commissioner Kircher?
Yes.
Okay, Mr. Chair, just as kind of a wrap-up of that, in our first round, we had $109,299 that went out. This second round is the $676,693. The third round will be the $25,000 for a total of $810,992, and we still have the grant program open until the 13th. So a fair amount of money going out for the small businesses and nonprofit. So
Okay.
115 grants
115 grants total.
getting in for the second.
Yep. So
Nice.
good support.
Good.
Thank you.
So
Okay. Go ahead.
I'm gonna get Mike in here maybe for the next one.
Thank you.
Thank you, Rick.
So, Mr. Chair, I do have
Good luck.
three additional board
wear the brown
actions
shirt when you're hunting.
this morning.
Okay, Mike is up, or what?
Yep, so we have a board action to, approve CARES Act funds to purchase 10 encrypted portable armor radios. And the background for this is CARES Act funds are available to improve mass dispensing sites' secure communications for public health, law enforcement, and traffic control. The cost of the radios is $44,050.30. The options are to approve CARES Act funds for the purchase of 10 radios or not to approve, and the recommendation is to approve CARES Act funds for the purchase of 10 radios, $44,050.30.
Is this with the radios like the firemen and them get, or?
Yes, it's armor radios, and they are encrypted radios also, so that we can use encrypted traffic, so the public can't listen to the traffic.
Yeah, the same as law enforcement has.
Yes.
Okay. Need a motion on that?
So moved.
Motion by Commissioner Kenizel. Is there a second?
Second.
Second by Commissioner Erickson. Is there discussion? Not roll call vote, please.
Commissioner Kenizel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker?
yes,
Commissioner Kircher?
Yes.
Okay, the next board action that I have is the purchase of an emergency management vehicle. The background for this is the Public Safety Committee of Todd County is making a request to use CARES Act funds to purchase an emergency management vehicle. The vehicle is a Ford F-150 truck. Price is state bid price. The cost of the vehicle is $40,339 plus licensing. Radio for the vehicle is $4,553.65. Hard tunnel cover for $1,200. Hard lights and radio installation, $3,120. See quote attached. Approve. The options are to approve CARES Act funds for the purchase of an emergency management vehicle or not to approve, and the recommendation is to approve.
Okay, is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Kenizel. Discussion? If not, roll call, please.
Commissioner Erickson?
Yes.
Commissioner Kenizel?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker?
yes,
Commissioner Kircher?
Yes.
Okay, Mr. Chair, the final board action that I have today for this CARES Act topic is using CARES Act funds to purchase a transport van. And the background on this is to approve the purchase of a Ford 10-passenger transit van, which will be used to transport inmates who may be COVID positive to other correctional facilities or clinic hospital appointments. The van can also be used to transport COVID positive bodies to Midwest Medical Examiner's Office for autopsy. This includes the van fully equipped. The options are to approve the purchase of the van or to not approve the purchase, and the recommendation is to approve the purchase of the van.
Okay, is there,
I'm sorry, Mr. Chair, the price on that is
Oh.
$46,760 using CARES Act funds.
okay, you've heard the request and board action. Is there a motion?
So moved.
Motion by Commissioner Erickson. We should probably have that dollar amount on the board action. Is it on there?
Yep.
Yep.
Oh,
it's
and there it is on the bottom. I was looking on the written part. Okay. Is there a second?
Second.
Second by Commissioner Kenizel. Discussion?
Steve, are you restricted on years of use for that? Like, I know within schools and things like that, a lot of times when you're using it to transport students and whatnot, they're limited on how old they can get before they're out of use or not, or is there not any restrictions like that? I mean, this thing should be
Nothing that I'm aware
around.
of out there for our end.
Right, so the mileage end of it, I mean, it could be here for years and
It's
years.
gonna be here for
Yeah.
probably a decade or more.
Okay, any more discussion?
Yeah, Mr. Chair, what will happen with this van when COVID goes away?
It'll still get used to transport prisoners. I'm assuming this may be going on for a while, and if there's another pandemic of any other
Okay.
sort, it would be used also for that.
All right, and it'll be stored,
It'd be at our impound lot.
okay.
The other thing is Steve said something about transporting bodies, which he's gonna talk to us about in the work session,
Correct.
which would work right into that, so. All right, any other discussion? Roll call, please.
Commissioner Erickson?
Yes.
Commissioner Kenizel?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker?
yes,
Commissioner Kircher?
Yes.
Thank you.
Thank you. So any other CARES Act discussion that I might have for you, I am in contact with the cities and the townships, trying to find out how they're spending their funds and if they need any assistance through this process. The deadline for the cities and the townships to turn over their funds, any that are remaining, is November 15th, and then our deadline is December 1st, so lots of communications going on with them. That's all
Okay.
I have.
Thank you.
Sounds good.
Come on in.
Good morning.
Good morning, Mr. Chair and
Good morning.
Commissioners. We have a few people here today. Come on up, Michelle.
Want me to sit down?
Yep, have a chair. If we're gonna speak, we wanna be able to, I'm gonna have you state your name first here.
My name is Michelle Buer, B-U-E-R.
All right, so our board action form in front of you is to approve a letter of support for Willow Bridge Recovery LLC. Some background. Willow Ridge Recovery LLC, an adult non-residential treatment program, is planning to open up in Long Prairie as of January or February 2021. As a part of the licensing process, Willow Bridge Recovery is requesting a letter of support or need from the Todd County Board of Commissioners. Options are to approve the letter supporting the Willow Bridge Recovery or to not approve. Our recommendation is to approve supporting the Willow Bridge Recovery LLC. Michelle, I'll let you talk a little bit about what the outpatient will offer.
Hi, thank you. Thank you for hearing me. We are going to be located on.
Can you move the mic closer to you, please?
Sorry.
Thank you. Just pull the mic up to you.
Pull it up, there you go.
Yep. There you go, thank you.
Can you hear me now? Oh.
Just wanted, the people on the phone couldn't hear you. So,
We're going to be located at 17 2nd Street North, Long Prairie, and it is going to be a non-residential, and so it will be an outpatient for adults for substance use disorder. And I will have 2 LADC counselors and a billing person, and then eventually a treatment coordinator and possibly a peer support person, and then myself, the director. We are looking to pull in adults, male and female, from the community and surrounding areas. And like Jackie had stated, looking to open around the beginning of the year, 2021.
Michelle has brought some of her
Employees, staff.
if you want to introduce them real quick. And
So Diane Notch is an LADC, and she has worked in the outpatient for several years prior to working at Endeavor Place residential adolescent program. Chana Dumprope is also an LADC and has worked in the adolescent residential program before. And Mickey, she is our billing specialist. She also worked in the adolescent residential program and has done billing for probably the last 5 years, and is also a former employee of mine for 9 years. So all 3 of those have been former employees of mine.
we bring this in front of you today. We have been in contact with DHS, and they are requesting a letter of support from our county commissioners in order to move forward to bring the outpatient services here to Long Prairie.
Steve, do we have anything in the jail for this?
I would assume that Jen would probably work with Little River, or Little Bridge, I'm sorry.
Our social worker, you mean?
Yes, our jail social worker.
Okay. Because that's where the need is.
All right, good to know.
But you can't have outpatient there all the time, so I was just wondering if you could provide I'm speaking out of turn here, but maybe a program in the jail that could help. I don't, do you have AA and all that come in yet?
Yes.
Okay. All right. And you said they worked for you before. I'm a little confused here, so what?
Sorry, I owned an adolescent program
Okay,
for 14 years in Verndale, Endeavor Place.
okay,
And so more recently I'd closed that, and now I'm looking to open the outpatient.
okay, good, thank you.
So all 3 of them have worked for me.
Okay. Okay, any questions, board members?
Mr. Chair, if you run out of space, there's a really nice school sitting up in Clarissa that needs to be utilized. I did tell somebody the other day I would bring that out, so if you do run out of space, there's a really nice school that would work really good for your facility, so.
Good to know.
Full salesman.
All right.
As a commissioner, I'd be more than willing to help you up there, so.
All right, good to know, thank you.
There's probably a lot of empty buildings around that she can. Which building are you in on 2nd Street there?
It's to the left of the AA clubhouse. It's between a sewing shop and the AA clubhouse. I'm not sure if you're familiar with where the AA clubhouse is. There used to be I think a chiropractor across the street from that building.
Oh, okay.
The big white building?
Okay, it's the old Newman building then, I'll bet, yeah.
Yeah, I'm not
Yep,
familiar with that.
okay, I know where it's at. All right, right across from the old Minnesota Power. Yep, okay, to the west. Okay, so commissioners, they want a letter of support, so do I have a motion? Who would develop the letter of support for us?
It's actually, I think Barb.
I think Barb had a
made
question.
Oh, I'm sorry,
motion,
Barb.
but it's on, we have that letter out.
Okay. Barb, did you move?
Yes.
Okay, motion by Commissioner Becker, is there a second?
Second.
Second by Commissioner Erickson, any more discussion? If not, roll call, please.
Commissioner Becker?
Yes.
Commissioner Erickson?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Kircher?
Yes. Okay, thank you.
Good.
For hearing me.
Thanks.
Thank you.
Thank you. Thanks
Good
for
luck.
helping us.
So our next board action form is to again review the COVID-19 situation for Todd County. As of November 2nd, we had 1,002 lab confirmed cases. This is up 278 cases from our last board meeting 2 weeks ago.
Thank you.
And 7 COVID-related deaths. Again, that is up from our last presentation as well. Again, just that statement, many with COVID are not tested, so the laboratory confirmed cases represent only a portion of the total number of people in Todd County who have tested positive, or who have had COVID-19. Cases no longer needing isolation is 769, which is 77%. We are seeing a 48.7% in males and 50% in women. Age range, and again, anywhere from 1 month to 103 years, with a case age average for Todd County being 43.7.
Jackie, the male and female, that switched, wasn't that
It-
male?
I mean, yeah, it's fairly consistent or even. There's no one gender that is getting it more than the other. It's just
I just thought before males were more than, but.
I can go over the state results now, which was as of yesterday, Sunday, because today's have not
You're gonna have
posted
to
yet.
pull the mic a little closer to you, Jackie,
All right.
so online they can hear you.
Perfect, thank you. Tests completed is over 200 million, 2.8 million. Lab confirmed positives for the state of Minnesota is over 150,000. Deaths for the state of Minnesota is 2,475. Total hospitalized is now over 10,000, with the age range of being 20 to 24 being those who have tested positive, the highest rate. And then community exposure, again, no known exposures. Cases no longer needing isolation in Minnesota is 129,663. Again, we work closely with our schools in the county here. We are seeing a case rate as of today, because we do, again, do the daily case rate for them to give them a snapshot of where we're at so they can plan ahead, and we're at 113 right now. We're expecting the next tentative rates be around 108 and 109 for the schools when they post it on MDH's website. So our numbers are increasing. There is community exposure, unknown, but we continue to work with our schools to help them when they do see classrooms or kids come back that have been tested positive. That is my
Jackie,
report.
you hear about all the hospitals being overwhelmed. What's our local hospital situation?
They are now keeping, I just understand unofficially, not from the CEO, but starting to keep some of those COVID positive clients or patients here in the hospital because Center Care is full in St. Cloud,
Okay.
the hospital. We are working with our nursing home as we're finding positives come through, like everybody else, with staff and some of their residents. That is not anything new to that world for our nursing home locally here. But yeah, they are starting to keep some of those cases locally versus transporting them to St. Cloud. They're working with staffing shortages, because their staff are getting sick. Kids are being distance learned or hybrid, where they're having, issues finding daycares. Daycares are becoming positive, so kids are being quarantined and and that's not an option for them. So we're seeing community-wide transmission at this point and trying to work through it all.
And then if I may, what in the county is offering any testing sites?
We are working with MDH to have a testing site come here to Long Prairie. What we last had heard, because we were like, how do you get on that list?
Yeah,
What we're hearing is we're gonna be meeting with them this week to talk about possibly any time after November 13th to come and do some community testing within Long Prairie. So more to come on that. Again, we meet with them this week to hopefully set up some dates and times to have that done or offered.
Mr. Chair, would that be free testing or, because
That's what I understand it to be, and that's what it's been offered in all the other communities.
some of the tests are costing
Yeah.
like $150 a test.
Yep.
So-
And depending on which lab company you're working with,
Okay.
it may vary, but it has been free testing for the community.
Okay.
and then,
And we might want to use if we can, we're gonna see what our options are for maybe a tent. I know our expo building will probably be tied up at that time in between November and December, but looking at what our options can be for drive-through testing.
Mr. Chair, Jackie, could you explain a little bit on the flu testing or flu shots on Wednesday? Correct?
Right. CentraCare is offering community-wide flu vaccination shots, and that will be at our expo building as well. So it'll be really nice to be able to work with them to see what the flow and the traffic and the staging and how we could do that for possibly a mass vaccination for COVID. But yes, Wednesday afternoon, CentraCare is offering flu vaccine administration at our expo building.
Okay, thank you.
Thank you for reminding me of that.
did you say free or is it?
No, you need to register before
you
you
need your
come.
insurance.
If I did, that was
Yeah.
not correct.
I didn't hear you say that, I was just
Okay.
wondering, so, no.
But that is a CentraCare event that we
Yeah.
will be assisting
Help and support.
with, yeah.
Good.
I just have one quick question. How is our positivity rate comparing to state right now? I see ours is 9 on here, is state, and are we similar or
I
higher?
would have to
State
find
in
that
the
out.
7s maybe? I didn't
I
look.
thought they were around 7, 8. Is Catherine in here?
Yep.
Oh, there you are, come on
Or
up.
come in either, I was a little scared.
You snuck in, please.
I didn't look,
I have
recently.
that more accurate information than I can,
The
so.
cumulative state positivity rate is 5.3, but in the last 2 weeks, it's 5.8.
Oh, did
So it has popped up, right? Ours dipped down to 6.6, and now we've seen it come back up to 9. So
Such a big number on the state, harder to see the bigger variance there.
it is increasing, though. It was mid-September, it was 4.8%, and now it's at 5.8.
Yeah. And are we kind of nearing the same peak numbers that we did earlier with like the ICU beds and stuff like that statewide? Or are we, do you?
I would, if
I
I'm.
didn't mean to make you look back, but from what I had looked earlier, it was, edging up closer to where we first peaked.
Right, when there was
Yeah.
community transmission.
Yep, it's about the same. We're seeing hospitalizations increase again as we're starting the second wave. What they're seeing, fortunately, though, is there's better treatment now, so people aren't in the hospital as long, which is good.
Yeah, I had seen an article where the mortality rate of hospitalized has definitely gone down.
Right.
That was pretty interesting to read. So the treatment is getting better.
Can I ask a question? Is the peak because we're in the cold and flu season? Do you think? I mean, is there any rationalization from summertime?
We're
to
finding
now?
that people are moving their outdoor activities indoors.
Oh, okay.
So then there's possibly more transmission when you're moving them indoors versus having that green space or outdoor.
Okay.
Mr. Chair, the flu is going around too right now, isn't it?
Absolutely.
Yep.
I have not heard have you heard from our hospitals if there's been, what their influenza rates are? Because they do post that on NVH as well, and I haven't seen that.
It's been pretty minimal so far, but, right,
Yeah,
it's
started.
bound to start. There's been cases, it's just, it has been minimal. We do think some of the COVID precautions are definitely useful for flu as well, so that we hopefully see less flu this year as we all take those same precautions.
Okay, anything else, Barb? Barb, anything?
No, I wish I was there.
Okay, I guess, thank you. So,
All right,
yeah.
thank you.
Thank you.
Oh, we got that next.
Okay, next one is the tobacco sales and access ordinance, public hearing. Am I right?
Correct,
Yes.
Second, this is the second reading.
correct.
So any comments from the public?
We have nothing.
No one here on the boardroom.
Do we move that, Mr. Chair, do we move that to the 17th to vote on it?
Yeah, I believe so,
Okay. All right,
because we can't vote right after the second hearing, so we should
Right.
wait.
okay.
Okay, then we'll move on to the solid waste designation ordinance. This will be the second reading. Is Chris here and Jeremy, is he on?
Let me clean my spot for you
Jeremy, are you online?
and get rid of the ladybug.
Okay. Chris is here, so this is the second reading. Is there any public comments?
No public comment.
Nothing online? I've not received anything. Board members?
Nothing.
All right, then are we gonna vote on this on the 17th also, or do we vote on this today?
There's 17th.
Chair, on the agenda, I believe at 9:40, there's a BAF requesting for the adoption
Oh,
of this
there, I see it,
ordinance.
okay.
So we can just move to that
So we'll
one.
just move right on to that, so I need a motion to adopt the solid waste designation ordinance.
So moved.
It's a motion by Commissioner Kneisel, is there a second?
Second.
Second by Commissioner Newman. Any discussion? If not, roll call vote, please.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Erickson?
Yes.
Commissioner Becker?
yes,
Commissioner Kircher?
Yes. Okay,
Thank you,
Done.
Commissioners.
thank you. Thank you, Jeremy. Okay. Is there any reports?
I just have, if anybody's interested in the absentee ballots, we received 3,370 absentee ballots as of this morning. 2,863 have been accepted, and unknown status, meaning they're still floating out there either to come back or in transmission right now, are 423. We've been very steadily busy last week, every day averaging 80 to 120 voters.
Chris,
And I
wanna hang out?
believe,
Sorry.
as of Saturday, we had
Wait a
115
minute,
people in here.
outside. Or do you want to ask him something?
Well, in my I was gonna give a report, but
You can go ahead, give your report.
are you done?
Yep.
Okay.
Chris, you want him to come back in?
Yeah.
Chris, sorry, I thought you wanted to talk to him out there. Get back in there. We'll play with you a while here, just sit down. Gary
Well,
wants to get.
last Wednesday, we had a meeting in Perm, and, Chris, I don't know, you wanna talk about, MCIT, that situation?
Sure. So, at the request of Prairie Lakes, we reviewed the situation with our insurance with the county, the Otter Tail County Attorney. And so I will try to talk about things that were in a closed meeting without making you close your
Giving away
meeting.
too much.
But on a positive note, I think we're moving forward to getting insurance. And that being said, there's still some difficulty. The situation is with MCIT, and I'm sorry, I don't remember, are you an MCIT member?
Yes.
So some of the bylaws in MCIT are challenging because what they say is for you to get out, as of this past August, if you wanted to get out, I gotta do the math, for the year 2023, you'd have to have canceled in August of 2020. That's 29 months of cancellation. And so what we've been trying to do at Prairie Lakes is to explore other insurance programs, because MCIT has told us that they may not insure us as soon as 2021. And so we said, okay, well, can we do that? Can we leave, can we go shop? And they won't give us permission to shop, which is challenging. If you can imagine for yourself, if they told you they might not insure you in January, and maybe you should go look elsewhere. Well, their laws say you have to give 29 months notice. We said, can you give us permission to do that? And their silence is a denial. So that's why we did write a memorandum of understanding to the MCIT board, just stating, you know, the facts, I guess. So they're working with us, they're trying to get us insurance, but at the same time, it's a little bit awkward because you'd think that if they don't want us there, they would help us leave. If they do want us there, they wouldn't tell us that we might cancel you. And all of this has nothing to do with our history. We have a good history of safety, of low claims or no claims. So, I guess, is that enough,
Yeah.
Commissioner? So,
Interesting. Okay,
Thank
anything
you.
else? Nope. Board members? Nope. Everybody's doing Zoom meetings, so it's kind of complicated, but we're getting through it, so. All right, if there is no other business before the board, or did you have something, Chris? I will ask for a motion to, no, this will be a recess, I'm sorry, recess till the 17th of November. Remember to go vote tomorrow, if you haven't already. And we'll see you on the 17th. We do have a work session. Can we go right into it so we can move along here?
Okay.
Yeah, I don't think this.
We only have one thing and they're both here, so. Okay, guys, you can come up.
Morning.
I'll just say, at the work session, attending remotely will be the media and Commissioner Becker. And in person here, we have Sheriff Ock and Chief Deputy Lonnie Marcy. So I think they just have to describe something that they want to do and let us then tell them if they want to bring it back in front of the board. So go ahead.
What we're proposing is modifying our contract with Midwest Medical Examiners for our agency that does all the autopsies for Todd County. I'll let Lonnie kind of speak to it. He's the one that's been on the phone with the Midwest Medical Examiners the most and getting the information.
Hold the
So
mic closer to you around Lonnie.
I'll let him go from here.
Well, currently, we're under contract with Midwest, and they have what's called citizen death investigators, which they come to all death scenes that we investigate at the sheriff's office. And what we're looking at moving forward is to the law enforcement model, which that means that law enforcement will conduct the death investigation from start to finish. We won't have to rely on the citizen death investigators. It'll be a substantial savings for Todd County. I think next year's contract with Midwest would be right around $60,000. If we switch to the law enforcement model, it'll go down to about $32,000. I guess I've always had the mindset that we're waiting for citizens to come help us investigate a pretty substantial scene, and our guys are already trained in these, probably well beyond what these citizens are. I guess.
I'll speak a little bit to that too. It's going to be a huge time saver for us because some of these citizen death investigators are coming from as far away as Pequot Lakes area. So we're already doing the work. They come, they're duplicating pretty much what we've already done. So all we got to do is have Midwest Medical Examiners come up, train our guys, officially train them, which a lot of them have gone through the training in the past. So, and we would be also saving quite a bit of time transport-wise. There's been times in the past where we had some issues where it's been 6+ hours before we've been able to remove a body from a residence or a field or wherever, because that's how delayed the transports are. So that's a huge deal for us because we always make sure a deputy stays on scene as long as that body's on scene. So now we're tying up a guy for potentially up to 6 to 7 hours. Well, we can do it all of ourselves and probably be out of there within an hour, 2 hours tops.
I would say 2 hours tops. It's
And
just,
if I may,
Yep.
I'm aware of, at least when I was there, that there's other counties doing this already. Yeah.
Correct.
Wadena does the law enforcement model.
Morrison.
County switched to the law enforcement model. It makes sense financially, and I was thinking, as an investigation, it is a lot more clean investigation. There's not so many people involved.
If I remember right, Stearns County has had it forever.
That could very well be. I'm not sure how they do it.
I had a relative die down there, and I had experience with the sheriff's office doing that. So.
Yep. And we have spoken with both Morrison and Wadena, and they like the way the law enforcement model runs.
Mr. Chair, would then that take place like the first of the year, the
Correct.
change or whatever on the
Yep,
renewal?
January 1st. I've already spoke with them and have them penciled in to come train us on December 8th and 10th if this goes through, so.
Okay.
And the training that they're gonna come provide, they provide for free, so it's no cost to the county, the training part.
And I guess I've experienced it myself. I know what you go through. You have to assign a deputy because of chain of evidence. If you got a homicide scene, you have to stay with the body, and it's just as time consuming. And if you're waiting and waiting and waiting, it gets old.
Yes.
And you're just sitting there like, God, when are they going to come? And then pretty soon it's 6 hours later they're there. So it's
Well,
just,
one example was probably about 3 years ago, and I was on that scene. We had to wait, and we called them like, it was like 3 hours into this now, and we're like, where are you guys? Well, we got diverted because they come out of the metro. Well, then had another call that they went to down in the metro, picked up that body. By the time they got done with that, then they came up here, and I think that was close to 7 hours. And so it's like, it'll clean things up tremendously.
tying up our officers who could be out there working in the field.
Correct.
Or doing stuff, other stuff. Okay, so what's the board's feelings? Bring it back?
Questions?
Next meeting
All right, yep,
on the 17th.
Okay.
sounds good.
All right.
Thank you,
Thank you,
guys.
Thank you much.
Thank you.
Ooh.